Welcome to the Siddha Podcast. Today's guest is Marty Wuttke. Welcome, Marty, to the show. It's a
Thank
great
you.
honor and pleasure.
Thank you very much. Great to be here again.
Marty Wuttke is a world-renowned neurofeedback practitioner. That's really what he's famous for. He was the first to implement a neurofeedback treatment in an inpatient psychiatric hospital in Northeast Georgia in the early 80s. Ever since then, he has worked with people to help them with neurofeedback primarily, but those are not the only methods he used over the years. Marty is also the author of the book The Brain Sutras, and he is the president of the board as well as the spiritual director of the Meditation Retreat Center, CSA, in Northeast Georgia, Lakemont. And he is the co-founder and co-CEO here in Santa Barbara at the Infinite Potential Institute. Welcome again, Marty.
Thank you. Thank you.
Marty, you have over 40 years experience in the field of neurotherapy and neurofeedback. To start with, could you please explain to our listeners who are new to neurofeedback what neurofeedback is?
Okay. Neurofeedback is a type of biofeedback. So it was discovered many years ago that any physiologic process that we could measure and then give feedback to the individual, they could learn to control it or alter it. So in the initial phases, there was muscle tension, biofeedback, skin temperature, breathing, perspiration. These were all useful methods. But then through some research, we found that by measuring the brain, literally the brain waves, the electrical activity that occurs in the brain, we could take that and give individuals feedback about when their brains were doing certain things. And sure enough, people learned how to control that. So neurofeedback is very simply giving, neuro, meaning the nervous system, giving the individual feedback about what their brain and what their nervous system is actually doing, and then learning how to manage that or alter it if need be.
So that means also that the brain waves are not the same for each person, so they change. How do they differ?
Oh, quite a bit. Depending on the individual's background and history, for instance, trauma, concussions, depression, addiction, and the environment that they were in, this produces a lot of different changes in the different areas and levels of the brain. So, and everyone is unique. You're exactly right. You never see two, we call them brain maps, that are the same. We measure 6,000 different metrics in the brain. And with the software that we use, all of those metrics are compared to a database of other individuals, that age and sex. So that information becomes the guide as to what we do with that person. We're looking for optimizing brain function. And that means quite a bit because there's so much electrical activity happening in the brain every second that we're alive. So
that means that now the research is at a point that we can actually we know how the brain should function or how it functions optimally, similar to the heart, where we know the heart should have a different rhythm and a variation. So the same we kind of know for the brain, and when we are measuring it, we can basically feed it back to the persons via feedback on the screen or a noise, and then basically adjust it through the via the plasticity of the brain. So it's a
Yes, exactly.
learning or training process.
Yeah, exactly.
Yeah, first of all, who can benefit from neurofeedback?
Um, Pretty much anybody and everybody. I mean, some people are going to respond much better than others, but people with any kind of uh, stress response, anxiety, sleep issues, depressions, and people with, again, with a history of any kind of trauma tend to respond very well to the process. It's not a magic bullet. Oftentimes, the way I've looked at it over the years, it is a complementary intervention when added to other things if that potentially are needed. But any practitioner who uses neurofeedback sees very quickly that when they treat the whole person with other modalities aside just from neurofeedback, the results are quite robust. You see people's lives change
Wow.
through a very simple process. Often people are startled by the power of learning how to make adjustments in how their brain is functioning. It has this effect throughout a person's life in terms of healing the past, being optimizing function in the present, becoming more organized, less anxious, less driven by fear and stress responses. All these things are benefits of neurofeedback.
So what comes first, the problematic brainwave or the issue?
Oh, good question. I think they're the same thing in essence. Brain waves are reflecting brain electrical and neurochemistry. Years ago, the big thing was, oh, your neurotransmitters are off. We need to give you this pill or that pill or whatever. But in essence, we can do the same thing with neurofeedback because that electrical activity that we're measuring and giving the person feedback about is the result of electrochemical activity and neurotransmitters within the brain.
Right. Yeah, we already mentioned that you really, you have done that for over 40 years. Do you want to give us a little bit of an overview, like how it all started and how that field is also developing?
Sure. Well, when I started working at the hospital you mentioned in the early 1980s, neurofeedback was relatively unknown. There was only myself and literally a handful of practitioners around the United States and around the world beginning to see how powerful it was. So the hospital was a 34-bed hospital. We had, five counselors on staff, a psychiatrist who was the director of psychiatric services, and a medical director. And we had the patients there for roughly 30 days. The length of stay changed a lot over the years because of insurance industry changes. But so I'm saying all that because the medical director saw very quickly what neurofeedback was doing for those patients who were getting it. He did rounds every night, walked around the hospital with the nurses and took notes and so on. And patients were, really astounded. Improved sleep, less cravings, less depression, anxiety, and so on. So the medical director saw, because he had a long background in addiction treatment and psychiatric treatment, so he saw and the staff saw how powerful the neurofeedback was when added to the other complementary methods of the program. So that just evolved over time. And the equipment back then was pretty rudimentary. You know, super fast computers had not been developed yet. Software was, it was okay, and we got good results. But over the past 40 years, the software has dramatically improved, largely because of technology. So it is a science that has evolved quite a bit over the years, and now, versus back then, a handful of practitioners. Now there are thousands and thousands of practitioners worldwide. I get emails and calls from all over the world, people wanting to start implementing neurofeedback into their programs, or just, as an outpatient service for various problems and disorders.
So right now you're using Loretta Z-score neurofeedback, which has a lot of channels, and I assume also over the years we have just there's much more data on the brain, which a brainwave of an individual person can be compared to. So how is that different now?
Well, back in the old days, we would just use one or two electrodes on the scalp. That was the standard, and still is in certain places and with many practitioners. But when Loretta's Z-score training came along, my experience of it completely changed everything, because, as you say, Loretta's Z-score training requires that the client wear a cap with 19 electrodes on it. Before that, we could train certain things at specific locations, but now we had a way to train the whole brain at once so that we could pull all of that activity together. Sometimes one part of the brain will be working fine, the other part may not be working so good. And the other huge breakthrough with Loretta Z-score training, Loretta uses algorithms, a three-dimensional algorithm that enables us to train deeper levels in the brain, not just surface cortical activity, but deeper levels in the brain. And that really changed things, because we could target various areas and in effect pull everything together. So that was the biggest breakthrough, and that happened in, I don't know, in the early 2000s. A friend of mine, a colleague of mine, developed the software and the program, and as soon as practitioners began using it, everybody started to invest in that and use that specifically as their treatment process.
So could you say that it's more precise now too? And how does that, is it different for your clients? Does it make a difference that you use this equipment?
Yeah, and that I had my practice when this first came out in Georgia. I had a large office, and as soon as I switched our method over, people started to make more rapid progress and more robust. As I said, people would just come in and start the process, not always knowing what they were doing, not knowing anything about brain waves. And suddenly, after a number of sessions, would start to report, oh my gosh, this is incredible. I've been doing psychotherapy for 50, all different times. I've tried this modality, I've tried that modality, I tried medication, but this has an entirely different effect a healing effect on me, and I can see it, the ripples of that throughout my life. And so once I saw that, again, this was in the early 2000s, I knew that this was the big breakthrough that I had really been looking for. Technology obviously keeps evolving and the science keeps evolving, but that was the big breakthrough. And then I began using that almost exclusively. There are a few exceptions to the rule, but that became, the primary modality. And I started to travel to Europe and trained many, many clinicians in Netherlands, for instance, UK, and those practitioners as well began to see how powerful it is.
Cool. Can you explain what the process is like for a person who says, "Oh, that could be something for me"? What happens then?
Yeah. Well, we start with a thorough history, physical, psychological, and we really like to know what a person's life, what potential factors in a person's life may be coming into play. So we go, our histories are very thorough. We want to know if there was any birth trauma, any developmental issues as the person was growing up, or if they lived in an environment or a household where there was a lot of stressors, everything ranging from, somebody in the family having an addiction problem, or anger management, neglect is also a big one. And those are all developmental factors that now are recognized as potentially creating hiccups in the brain development that may potentially, in a large number of people, show up later on in life and cause all kinds of problems with, personal behavior, relationships, jobs, and so on. So we want to gather together as much history as we can. And sometimes people will say, well, why do you need to know all this? And we try to explain, well, because this is all important information for us as we look at your brain and how it's functioning. So after that, after we get the thorough history, we schedule an intake and assessment. In that session, the client wears the full cap, and we do a couple of recordings. One eye is open, one eye is closed, and we are literally looking at that person's unique brain, seeing where the activity is in optimal ranges, and then more importantly, where the activity is outside of the normal zone. Then we can correlate the problematic areas of the brain with the issues the person is dealing with. And that is often a profound confirmation for the clients. So many of them say, oh, see, I knew this wasn't just all in my head, although that's sort of really what it is. So they begin to recognize how that brain activity has been affecting them or is affecting them. And then the caveat, the great part about that is they can learn to change that. And then, so after we have all that data, we design a very specific protocol unique to that person, their brain, and whatever their specific problems are. Once we've determined that, and we can do that within an hour, a little over an hour, then we start the training process. So after that, and we determine, what's appropriate. Should this person be coming once a week, twice a week, 3 times a week, or every day? And of course, when I was working in the hospital, in order to get the right number of sessions in, we had to do sessions every day, and we called it an intensive program, which we do that here, not in the hospital, obviously, but outpatient. We have people come from all over the United States and from different parts of the world to spend 2 weeks, in a local Airbnb or a hotel. and they come in every day for 2 sessions. And in 2 weeks' time, it's amazing what changes can occur, and lasting changes too, I should say. Some people need more, and that's more often than not the case. So if they come for 2 weeks, they may come for a follow-up after a few months. But people who live locally often will come a couple of times a week. It's a training. It's like going to the gym. You have to be consistent. There's a learning curve that occurs, and each session builds on the prior session. So there's this progression over time. And even though in the beginning people don't always immediately understand what they're doing, they start to see the results fairly quickly, and that further motivates them. So we do that, and we redo the brain maps after a number of sessions, and look at the brain and see that it's changing. And also, I should say, in that first intake, oftentimes we will decide at that point, number one, if it's appropriate, and number two, are there other interventions that are needed for that individual? And that can be anything from counseling to psychotherapy, acupuncture, cranial sacral work. All of these other interventions are complementary and will speed up the process quite a bit if in other words, if we're really working with the whole person. Nutrition is another huge part of it. That I have a background in clinical nutrition, but we have some very good naturopaths here in Santa Barbara that are quite adept at counseling people, taking labs and measuring various physiologic things like blood sugar levels, hormonal issues, cortisol. All of those things are looked at if we feel it's appropriate.
Right. Because they are also influencing the brain again. So it's
Yeah,
kind
the
of going
fuel, it's
back
the
and forth.
fuel if you within. If the fuel's not right, we're going to have trouble getting that brain to shift in the
Yeah.
appropriate direction. Yeah.
And if not taken care of, stress, for example, can actually change the brain structure and how it's working. So,
And so many people that we see are chronically undersleeping. Oh, I get 5 hours of sleep a night and I do fine. And I'm sorry, it's just not true. The brain needs those hours of sleep of, the different stages of sleep. It needs REM sleep. It needs deep sleep. That's where the brain recuperates, cleans itself out. Sleep is really the most important factor, I believe, for neurofeedback to be successful. So we counsel people about sleep. Some people will get, different devices that measure their sleep, and we keep an eye on that because that's huge. That's very important. I don't know. I think about 90% of the clients we get in are have some kind of a sleep issue, whether it's frequent awakening, or not getting deep sleep, or not getting REM sleep. REM sleep is extremely important for memory consolidation and cognitive function. Deep sleep, just as important, if not more, for the brain's rebuilding processes. A lot of hormones are released during the deep sleep cycle, and they are regenerative and rejuvenative.
how can your feedback help with sleep issues?
Well, they're often related to we call it dysregulation in the EEG. And so the sleep cycle may be interrupted by stress, by various, even can be past trauma or current trauma. And so, in the waking state, when you begin to correct the way the brain functions, it's not just while the person's awake, that carries over into the sleep cycle. And we, as a rule, every time a client comes in, how did you sleep last night? And you can see it in the EEG. When a person has had poor sleep, it starts to show up.
Mm.
And then on the other side, when a person's sleep gets better from the neurofeedback training, their results are more robust.
Mm. So would you say if a brain is basically optimized with new feedback, that automatically will improve sleep as well?
Yeah, automatically, unless there's other factors involved, and we take a look at that too. Again, whether it's nutrition, whether the client has other challenges in their lives that they're not either not recognizing or just not facing, we will look at that as well.
So you mentioned that new feedback helps decreasing the symptoms or sometimes, also resolving them. Um, what what else does new feedback do? Is there more to it, or are there some things old people experience when they do new feedback?
Well, because of the process, you're just holding up a mirror to that individual, showing them in the mirror what their brain is doing, and then when it begins to shift, what that looks like. So it's not just for people with symptoms and problems. We get many, meditation is quite popular now, and I don't know how many times I've heard somebody say, I just can't meditate. My mind won't stop. And, say meditation involves really changing the brain. And that doesn't happen right away. You're not born with the ability to, go into a meditative state. So many meditators come and we can oftentimes see what's going on in their brains that may be, hampering the process. And now, and neurofeedback is becoming quite well known among athletes and CEOs and people who are looking for a peak performance. I just know I'm not at the top of my game. I may be 70% there, and I want to really up thing. And so neurofeedback has really become quite well known. There's many famous athletes who have used neurofeedback, and swear Tom Brady for one, and many others in the NFL, not just for, the multiple concussions many of them experience, which neurofeedback is very good for that rehabilitation, but for sharpening their skills, their visual motor skills, their cognition, their reaction time. So neurofeedback definitely has application to not just people with problems and disturbing symptoms, but this whole, optimal performance model is becoming quite popular now. We've had quite a few here. California tends to be, the place where there are many successful people, and people who have sort of reached the top of their particular profession, but know there's more. Feel that, either they're being blocked or their brain could use what many people call tune-up to get them functioning better.
Mm. You mentioned meditation as well, and when people start to meditate, one aspect or byproduct, so to say, is that people become more the observer, become more aware of what they are doing, what others are doing. Um, would you say that new feedback helps with that too, or with awareness or being aware?
Yeah, it's very interesting. And literally just yesterday, we had a client who is facing a lot of obstacles in their lives. And after less than 5 sessions, recognized where that pattern was coming from. I won't get all into it, but it was, what we call a aha moment for them, and was a rather profound realization. We have that happen a lot. And so the person through, as you say, self-awareness, begins to recognize their own emotional or psychological blocks to what they're searching for in their lives. And again, that does happen with meditation, but it happens much more quickly with neurofeedback, we've noticed. There's also a spiritual component too. There was a book written many years ago by two of the pioneers in neurofeedback, Elmer and his wife Elise Green, and the book was called Beyond Biofeedback, and talked specifically about neurofeedback as almost a spiritual path to, nothing religious, but to awaken one's own spiritual resources and give the person access to their own intuition, their own inspiration and creativity. And I've had many playwrights and writers come in working on books and various things, and I've always noticed that their work improves dramatically when they start going through the process, because it's an inner process, it's an inner exploration, if you will. And the interesting thing is that anything that is, any mental pattern or brain pattern that is resistant to change oftentimes reveals itself. I think, the human brain is quite remarkable when we learn how to manage it. It will guide us if we give it the opportunity.
So it can even unveil potential we are not aware of.
Absolutely. Absolutely. Yes, creativity and intuition, which is really important for us to function on a daily basis. These things start to become more pronounced, more fine-tuned.
Awesome. Lately, there have been a lot of new devices on the market. Some claim to be neurofeedback devices who aren't really, by definition. They're just measuring the brain wave and then, for example, stimulate it. So neurofeedback is really an non-invasive practice, a non-invasive method. Now, there are real small neurofeedback devices on the market. Would you recommend any of those, and how are they different to what you are doing?
Yeah, nothing is, that you can buy over the internet is going to match what we can do in a clinical setting for a couple of reasons. The vast experience and background that we have, and the quality of the equipment that we use. That's both hardware and software. I mean, you can't, it's like, doing surgery on yourself. You're not going to get the same results as you would if you had gone to an experienced surgeon. But there are several devices out there that some people like. Of course, people who are a little bit entrepreneurial are going to look for, devices that they can manufacture and sell for people to use at home. And some of them are okay. Some people get good results, but you have to keep in mind that most of those devices follow a one-size-fits-all model. So it's not individualized to that person's unique brain and unique problems. But some of them are not too bad. I haven't seen anything that I am, 100% endorse. But there's a couple of devices out now that are okay. They're not expensive, and a person can do it at home. They're simple to use. But you have to keep in mind that this is not true neurofeedback that is implemented in a clinical setting like this.
I think one tricky area with using it at home is what happens if I, don't feel so good afterwards. So is everybody, kind of improving right away, or can also, I mean, how can I tell if the program of the device is not ideal for me, in contrast to that I may have an emotion coming up from, a past traumatic or impactful experience, which can also happen during the transformational process.
Yeah, I mean, it largely depends on the individual. And what I usually say, if it doesn't feel right, don't do it. There should be this intuitive or internal recognition, like, is this working for me? But as you say, sometimes having feelings and emotions come up means that number one, that's a good thing, but the process may need to be facilitated, number one, by a counselor or a coach or a guide, and number two, it may not be the right protocol. As I said, these devices are one size fits all. They are not tailored, literally not tailored to that individual's brain. Does that mean you can do the wrong thing sometimes? Yes, or too quickly. So that's my only problem really with the at-home devices, is that what our experience has been is that it is a very powerful process and needs to be recognized and respected that way, and then guided along appropriately according to that individual's brain, that individual's history of trauma or not, and then guided along appropriately.
It's a little bit, it reminds me, even let's say the technology advances in the next 30, 40, 50 years, which it sure will, um, it's still, a little bit of an insecurity if you don't have a clinical setting. It could be maybe compared to the psychedelics, which you could, just use yourself, in the woods, or you use it in a clinical setting where it's a complete different thing because you have an experienced clinician, psychotherapist, or the like, or guide with you. You are in a safe environment. Someone is taking care of you. Would you say it's similar important to
Very
have
much.
someone with
That's a
you?
very important point. As I said, it's important for the clients seeking neurofeedback that they make sure they do the kind that's right for them. There's nothing wrong with trying one of these at-home devices and seeing if they get any result. But oftentimes when people do that, they realize that there's more, and they will seek out, a clinical practice in order to deepen the process that they're going through.
Right. Um, yeah, so where do you see the future of the field? Where are we heading?
Well, to be honest with you, I never thought we'd get this far. Back in the early 90s and 80s, I knew that we were limited by the type of neurofeedback, that just these one or two electrodes on the head was a limitation. I always, sometimes I felt like, that game whack-a-mole where you hit the mole and it pops up over here and you got it, usually at carnivals. Sometimes it felt like that we were having trouble reeling the whole brain in. And so when the new technology came along in the early 2000s, as I said earlier, it was this breakthrough. All of a sudden we could monitor everything at the same time, in real time, unique to that individual, and see what was happening. Was one part normalizing function, then another part, not cooperating. This was a huge breakthrough. So along that line, I think that that's what the future is going to hold. That, because of technology, because of hardware and software advances, fast computers, that we're going to see it evolve accordingly to I envision someday neurofeedback being a part of most mental health, behavioral health programs. And in fact, right now, it is in a lot of centers, whereas, in early 1980s, it was only myself actually doing it in an inpatient hospital setting. But just like you can go anywhere now to get physical therapy or occupational therapy or speech and language, I predict that neurofeedback will be as popular and as available as those other modalities once people start recognizing how well it works.
Right. That more and more will be aware of, and
Yeah.
also for peak performance, because often problems are not necessarily on a clinical level, but still, people feel limited in their daily lives.
Yeah, I think this idea of tuning up the brain, we spent decades on the body, now there's a gym or a health spa in almost every corner here in Santa Barbara. I think there's it's a 90,000 population. We probably got 20 places where people can go to exercise and get their bodies in shape. But in the last decade or so, we're moving more towards brain health. We know that many of the problems and issues we're dealing with, dementias, Alzheimer's, cognitive decline, that is not necessarily an old age phenomena. I mean, that's being talked about a lot. And I've noticed a lot of experts in the field of psychiatry and aging are recommending, if you don't, or they say, if you don't use it, you lose it. So exercise your brain. In my opinion, there's no better exercise for the brain than neurofeedback. It keeps the pathways sharp, keeps them functioning right. So I think we're going to start taking more and more care of our brains now as, this baby boomer generation gets on in years. We want to avoid these issues of cognitive decline and so on.
Well, it was great having you at the podcast again, Marty. Where can people find you, and how can they work with you or get in touch with you?
Through our website, Wuttke IPI. IPI stands for Infinite Potential Institute. So WuttkeIPI.com. It's an excellent website with lots and lots of information, different interviews and so on. I've done hundreds, if not thousands of interviews over the 40 years, and recently, this past couple of years, done many, many podcasts. But the best way is just to go to our website, read a little bit, and then through the website, you can contact us.
Okay.
And then from there, we can, either set up a free phone consultation to answer questions and see if neurofeedback might be appropriate.
Okay. Okay, great. And we will include the link and information when you watch that on YouTube below. Also, if you like this video, please like it, subscribe the channel so that other people will also find this video and can watch it. Thank you for watching. And thank you, Marty, for being with us today. Have a wonderful day and see you soon.
Thank you. Very grateful to you for doing this.
You're welcome. Bye-bye.
Bye.